5 and 6 a.m. on SABC News Channel.
Welcome back. Let's take you here now. Higher education sector today held a roundtable discussion on youth health and wellness in the post-school education and training sector. Now, the discussion included real-life testimonials from student survivors, reforming perpetrators, voices of a civil society, leadership in sector, including student leadership. Now, to tell us more about this, we are now joined via Zoom by CEO of Higher Health, Professor Ramneek Ahluwalia. Prof, thank you so much for your time this afternoon. Now, let's get right into it. I mean, of course, this is a very sensitive topic, particularly because you are dealing with survivors who obviously some of them are still continuously seeing their perpetrators walking around some of these campuses. Talk to us about how these roundtable discussions were structured and what are you hoping to achieve by them?
So, Unati, thank you and good afternoon to everyone. Unati, what we have done today is basically alleviated what we do every day in our campuses through our co-curriculum programs. And there's a whole module on gender-based violence, gender diversity, gender equality. Similarly, we've got modules on mental health, modules on civic education, modules on sexual reproductive health, HIV, drugs and alcohol, issues that kill our society, issues that affect our young people, pandemics and epidemics, which are health and social. And what we did today was we alleviated that classroom in a constitutional hill. We said we will have this classroom in a constitutional hill. Real life testimonies teach others, which is peer to peer. We had survivors who have dealt with rape while being in institutions of higher learning or whether in their communities. Survivors who were beaten by their boyfriends or partners, students who live with mental health and how difficult it is to live with mental health. We had real life testimonies of a perpetrator who actually come out and say, I am a perpetrator, I have done something wrong in my life, and I'm now a reforming perpetrator, I'm trying to reform. What happens is with these real life testimonies is a pedagogy becomes interactive, participatory. When you have a group of about 500 young people listening to live testimonies peer to peer, they understand these pandemics far more deeper. The aim is to empower young people to understand these pandemics by applying it onto themselves or something that is happening in their families, in communities, on daily lives. And the aim is that can educated young South Africans, can we empower them? Can we educate them about these issues? Can they challenge social norms? Can they have these difficult conversations back in their home, in their families, in their communities? Can a societal norm that is killing South Africa and our youth can be challenged by an educated young people? And if that can happen, a whole new generation can transform to be good citizens. And hopefully, through that, we can fight these very difficult challenges and pandemics. So a roundtable involving Commission of Gender Equality, involving South African Police Service, involving National Prosecuting Authority, vice chancellors, principals of the colleges, student leadership, campus security officials, together with real life testimonies and students to say, we need to find the solution together because we are a microcosm of a bigger society. We cannot deal with this pandemic just like that.
And of course, you are right, Prof, because what we are seeing in institutions of higher learning is, of course, a bigger problem in our society as South Africa. As you know, I mean, a recent World Population Review placed South Africa 4th in as far as rape cases are concerned globally. That's around the world. We are number 4, which is serious. So roundtable discussions have a place in society in terms of providing solutions, etc. But one of the biggest concerns emanating out of sexual violence cases and women and men reporting around them is, of course, the prosecution levels that are dismal at this point in time. You know, higher learning institutions, what systems do they have in place to make sure that when a victim does come out to report a case of rape, they're not shunned, they're not turned away, but they are indeed helped?
I will answer this question, but I will start by a point to say that we started seeing some impact. Since we have a policy of gender-based violence launched in 2020, we introduced even a curriculum on gender-based violence, gender module, as kind of very critical for institutions to trust and believe empowerment as a very important tool called education. Last year, about 124,000 young students enrolled into this curriculum. 80,000 did risk assessments on their life on domestic violence, sexual violence, partner violence. 8,766 cases reported GBV. For me, this is the start of at least trust and empowerment of understanding that people are out to seek help and people can report. Now, these are domestic partner violence cases, and the aim is either they will report for psychosocial services if these are underlying relationship issues that they want to move. But for cases like rape, cases like sexual assault, student-staff relationships, we have now put what we call as protocols, and learned from COVID-19 the word called protocol. But protocols are algorithms and minimum standards that institution has to come with. We have released now what we call it as an implementing guidelines on how to deal as an institution when a case of sexual assault is reported in the institution. There's a role of higher education in it. For example, responsible office, disciplinary building of a disciplinary tribunal, which is non-management biased, having civil society, gender, students, staff, everybody together when a disciplinary system is put together. Reporting complainants, how a complaint is registered, both formal and informal systems. Campus security and campus safety, vetting of campus security, both private and in-house, as far as ensuring that campus security understands GBV sensitizational, emotional intelligence, and can they be the first respondent towards recording evidence so that that evidence can really be safeguarded before even South African Police Service or NPA is brought into the picture. Safe room, psychosocial services, rape kit, these were things that, yes, we agree never existed, but have now started finding face into higher education. So higher education's role is teaching and learning and research, but community support, community engagement, and looking at this pandemic, and it's high engulfed into post-school education, higher education. It's now become onus on higher education institutions to work around policies, to work out infrastructure, put these systems and controls, because I think before we start relying on judicial systems, which obviously are the right way, we have to also do one part ourselves first in order to protect the victim and survivors.
Prof, thank you so much for your time this afternoon. Really do appreciate you unpacking that dialogue currently happening now. That is the CEO of Higher Health, Professor Ramneek Ahluwalia. Let's continue here now. Kenya's veteran opposition